give you 0.05. This fine. This fine. Okay, so basal ganglia. So you guys, we're gonna try to have a discussion, and I know, like, you guys have been doing the neuro, so you guys are gonna be better at this than me. So, but I try to organize everything, and get everything that was in the lecture. So basically, Dr. Wilson begins off just with an aside. It's kind of almost like totally irrelevant to basal ganglia, right? So he talks about balance and symmetry. I should probably pull this up. So like the first couple of slides is like balance and symmetry. So you see it, right? Balance and symmetry. This guy here, Horner's syndrome. This, and then this. All right, yeah, so he starts off talking about balance and symmetry, all right? Then he says, like, it's important in medicine or in the practice of medicine. So he gives these just clinical situations of where balance and symmetry would be important, all right? So he gives, like, the Horner syndrome, right? So in this case here, I mean, it's obvious. This is like Two-Face, right?
Yeah.
It's like Two-Face, right there. So, but yeah, so we got someone with Bell's palsy, right? So the fact that this guy's face is not symmetrical is helping us to diagnose the condition, essentially, right?
Right.
So for Horner syndrome. Then we got lesion with genial glossus, right? So this is basically where, of course, you have a lesion, and then the tongue is going to protrude towards the side of the lesion, right? So cranial nerve 12, right? Cranial nerve 12 lesion. So the side that is lesioned, so let's just say this side is lesioned, then the tongue is going to be protruding towards this side, right? And that's what we see here, right? And then the last thing he mentioned is like the lesion of the eyes. So like involving the vestibular nuclei. He just mentioned these, right? Before he gets into basal ganglia. Did everyone get this?
Yeah.
You got it?
So it doesn't necessarily tie into basal ganglia at all.
He just mentioned
Complete tangent. Okay.
Yeah, complete tangent. Montfiston.
Yeah.
So what were the three things that were clinically important for balance and symmetry?
It's important in diagnosing.
There were three things we just mentioned. What were those three things?
The tongue,
That's right.
the eyes,
What was the tongue about?
the genioglossus.
Okay, that's right.
Genioglossus muscle.
That's right.
So if you have a lesion, then it's going to push ipsilateral to the lesion.
Okay, that's right. Okay, the tongue, the eye, and then what was the last one? Starts with an H.
Horner syndrome?
That's right, Horner syndrome. Okay, cool. So now we actually get into the. Are you guys having side conversations here? You know, I didn't approve of this.
No, they're just really happy that you're here. Like I said, we're all really happy that you're here. They're really just saying, "Wow, he's amazing, and we're gonna take it from you." Is what's going on. So, please take no offense.
Oh man, that's crazy. I mean, I can understand if you were like on the same side, but like this is like across the room.
So we're used to just not paying attention at all.
Trust me, the fact that you have us all here at 8 o'clock and tuned in, please take them all as compliments.
All right, I got it. I will do. All right, so now we're getting into the basal ganglia. So I kind of restructured some of the things. I think it would be easier to start off with the anatomy. So the basal ganglia, just some of the parts. So we have the caudate nucleus. All right. So the caudate nucleus is running in the lateral wall of the lateral ventricle. All right. So let's see if I can get an image here. Okay, so here, boom. This is your lateral ventricle, right? and there. This is your caudate nucleus, right there. So it's running in the lateral wall of your lateral ventricle. All right, if you didn't see that, let me give you another image. All right.
That little white piece, okay,
There it is. So this is your lateral ventricle. That's your caudate nucleus. If you're yet unconvinced, there it goes again. Cool?
yeah. Okay.
Caudate nucleus. Oh dang, I need to copy this. Alright. Cool. So first part that we have is the caudate nucleus. Runs in the lateral wall of the lateral ventricle. So you guys, I'm gonna ask you guys spontaneously questions. Alright, so just try to memorize everything as we're going. I can ask you anything. And if you guys want to ask each other questions, then you can also do that. Like so, if you want to ask Carl a question, or Carl, if you see something you want to ask Amara a question, you can also do that as well. Okay, so the caudate nucleus has parts. All right, so it has a head, a body, and a tail, and we can see that here, right? So boom, that's the head, that's the body, and that's the tail. So the amygdala is not part of the caudate nucleus. What Dr. Wilson said in lecture is that the amygdala is not really part of the basal ganglia, but it's usually just shown in association with it.
Well,
Yeah, so
question.
yeah.
The fornix, is
Right.
that part of the caudate nucleus?
I don't think so. I've never heard of it being mentioned
Oh.
as part
Cortex
of
is
it.
what, hippocampus, right?
It's part of your tactile circuit.
Okay.
Yeah, because I didn't see it in this whole lecture. I never saw fornix. Okay, so we have the caudate nucleus. All right. Now we also have the putamen. All right. When you have, okay, and let me show you where okay, so you can see the putamen right here, right? This is your putamen. Actually, all of this is your putamen. So all this right here is your putamen, right? And let's get a better view of this. Here's the putamen right there, caudate nucleus. Here's the putamen right there. It's your caudate nucleus, separated by the internal capsule. Right? Okay, so the caudate nucleus and your putamen together is going to make up your striatum. All right? Also called your neostriatum. Caudate nucleus plus your putamen makes up your striatum. All right. Now this neostriatum or striatum has a mosaic organization, which I'll show you shortly. You guys, let me know if I'm going too fast. I can slow it down. All right. Okay, so here it is. So this is what Dr. Wilson showed in lecture. So you guys can see the mosaic pattern, right? So the fact that the caudate and the putamen, they both have a mosaic pattern, is showing that they're both like related to each other. And we're going to see that they have similar functional roles. So they're both going to serve as input centers in your direct and indirect pathway. Okay. All right. So caudate putamen is your striatum. It has a mosaic organization. They will serve as inputs into the basal ganglia. All right.
Wait, hold on.
All right. So we're starting off, and we looked at the caudate nucleus, and we said it was in the lateral wall of the lateral ventricle, and we said that the caudate nucleus plus your putamen makes up your striatum. And we said they both have a mosaic organization, and they both are going to serve as inputs into the basal ganglia. All right. Now, 90% of the cells inside of the striatum. All right. So, quick question for you, Mara. what are the two components of the striatum?
Caudate nucleus and the putamen.
All right, cool. And what is similar about them?
They both have what, mosaic organization.
Okay, that's right. And what did they serve, and what function did they serve for the basal ganglia?
As inputs.
Okay, cool. All right, so 90% of the cells that are present in the striatum are medium spiny neurons. And that's kind of crazy, right? Medium spiny neurons. One second, see if I can find it. All right, this is not working. There it is. All right, that's the guy right there. That's a medium spiny neuron. So this medium spiny neuron is present where?
Neostriatum.
Okay. And what is the striatum made of?
Caudate nucleus and putamen.
Cool, that's right. Okay, so now these medium spiny neurons, so it's 90% of the cells there. They're going to be using GABA, and GABA is inhibitory. And it has low spontaneous activity.
Most question for you. So
Yeah.
like in the types of neurons that we learned, like
Yeah.
unipolar, pseudo-unipolar, stuff like that.
Yeah.
What kind is that?
I mean, so you're saying, okay.
Is it that a type?
I think it's just,
Spiny?
It's just
well, it,
I didn't say it had to be alcohol.
oh, man.
Forgive me, go ahead.
One second, this thing is malfunctioning. See, technology is not always good. We'll just continue anyway. Okay, so yeah, so for the putamen and the caudate, we said is our striatum. We have the medium spiny neurons, and they're using GABA, and they're inhibitory. So that's why we see that this is inhibiting the GPI and the SNR. So GPI is globus pallidus interna, and SNR is substantia nigra reticularis. So it's inhibiting this. Okay, now, so we talked about the striatum, and we said that this is how we're getting into the basal ganglia, right? So we're getting into the basal ganglia via the striatum, right? So once we get into the striatum or whatever, so we know that the striatum is made up of the caudate and the putamen. Now, where was the caudate nucleus located?
The
Question for
lateral
you.
wall of, oh, I'm sorry, I think you pointed at me.
Well, since you already started, what you can you can
Do that now? We're gonna do that now.
you can
The
come
lateral
forward.
wall of the lateral ventricle.
Okay, cool. And so the caudate and the putamen is going to interact with what? What is it interacting with?
I need that one too.
Internal capsule.
Okay, well, the internal capsule is separating them. But in terms of what are they going to be inhibiting?
Globus pallidus internus,
That's right. And the what?
substantia nigra.
That's right, substantia nigra reticularis. Okay, so when we're trying to get into the basal ganglia, striatum. When we're trying to get out, globus pallidus interna and substantia nigra reticularis. Cool?
Yeah.
Question.
Yeah.
Is there a specific name, like how we did striatum? Is there a specific name for GPI and substantia nigra reticularis, or is it just
Yeah, they never gave them a grouped name.
okay?
Yeah. But we're gonna see another group name pretty shortly, but not for these guys.
Okay.
Okay. So we talked about the caudate nucleus, striatum. Now we're talking about the lenticular nucleus. All right. So the lenticular nucleus is going to be composed of putamen and the globus pallidus. We saw putamen with the striatum. So caudate nucleus and the putamen was a striatum. But lenticular nucleus is a putamen in the globus pallidus. Alright, so once again, this is the putamen right here. So let me erase this. Alright, this is the putamen right here. This is the caudate nucleus right there. Alright. Now both of these together was our what? Both of these together was our what?
Striatum.
Striatum, that's right. Okay, now this is our globus pallidus. Yeah, I don't know how clear this is. I wish I could zoom in more, but it's not allowing me. I think I could bypass this. I can deceive the computer. Okay, so this is the globus pallidus. This right here is the externa, and this right here is the interna, and this is our putamen. Right? So then both of these together is our lenticular nucleus. Right? But both of these together was our striatum. Does that make sense? Could you see that from there? Yeah. Okay, so lenticular nucleus was the putamen in the globus pallidus. The globus pallidus is also referred to as the paleostriatum. So what was the neostriatum?
Putamen and caudate nucleus.
That's right. Okay, so the globus pallidus has two parts, GPE and GPI. GPE is globus pallidus externa, and GPI is globus pallidus interna. So remember that what we're talking about is the anatomy of the basal ganglia. So we're talking about the components of the basal ganglia. That's what we're talking about. So we mentioned the caudate nucleus, the striatum, the lenticular nucleus. And now we're getting into the substantia nigra. The substantia nigra. So where is the substantia nigra located? That's the question. Where is the substantia nigra located? Do you guys know? Okay. I forgot all that stuff.
Oh, cruciate.
Yeah, that's right. That's exactly right. Were you looking at the
You don't even have, oh, you have it up there?
Yeah.
Where does it say cruciate? Oh.
I think you're pretending to get into it. I'm just playing. But anyhow.
I can draw it for you.
It's all good though. It's all good. Alright, so so it's located in the sub-thalamic area, and it's gonna be dorsal, so behind the crus cerebri. Okay, so here goes the cross section. Alright. So well, first of all, so here goes our thalamus. Alright. Now, this is the sub-thalamic area, so below the thalamus, right? Sub-thalamic. And right below that, right here, we have our substantia nigra reticularis. Can everyone see that?
Mm-hmm.
So that right there. So first of all, in terms of orientation, the substantia nigra is below the thalamus. And now it's going to be dorsal to the crus cerebri. So here goes the crus cerebri, right here. And this right here would be your substantia nigra. So this would be your substantia nigra. Alright? So the substantia nigra has two parts. Alright? Sorry, go ahead, did you?
So I've always struggled with this.
Mm-hmm.
When we're looking at this crus cerebri, right?
Yeah.
The bottom of the image is front.
Okay, so let's see. Boom, boom, boom. Sectioning.
What do you mean?
Okay, so
Like, where are we?
this is okay. This is cerebral aqueduct,
Mhm.
right? Let's see here. So,
So
brainstem.
this is midbrain.
Mm-hmm.
Okay.
So your superior colliculi, they're on the dorsal aspect.
They're on the dorsal aspect. So the bottom of the image is anterior and the top of the image is posterior.
This would be posterior,
Okay.
and this is anterior. But I'm just saying that dorsal to,
Okay.
in
yeah, no, that makes
relation
sense.
to the crus cerebri.
No, it makes sense. It makes sense.
Yeah. So it's behind the crus cerebri. Yeah. So the substantia nigra has two parts. You have the pars compacta, which is right here. It's your pars compacta. And then you have your pars reticulata, which is more sparse. Compacta because their cells are more compacted. Reticulata because the cells are more sparse. Reticular, they're more like a net. You know, more like spread out. All right, just like what we already said, so substantia nigra has two parts. So what were those two parts?
So pars reticulata and pars compacta.
Okay, that's right. So pars compacta is it's a dense cellular area or region. All right. The cells are going to be producing dopamine. All right. Yeah,
Okay, just compacta.
just for the compacta.
Okay.
All right. So this layer is diminished in people with Parkinson or patients with Parkinson. So if this layer is diminished in people with Parkinson's, then what won't they produce enough of?
Dopamine.
That's right, it won't produce enough dopamine. All right, so then for pars reticulata, the cells are sparse, they're producing GABA. And now if the pars reticulata is producing GABA, what do you think it will do to whatever it's synapsing onto?
Inhibit.
It's going to inhibit it. So we have what? We have the striatum connecting to what?
The globus pallidus and the substantia nigra.
Globus pallidus what?
Internal.
Okay, and the substantia nigra,
Reticulata.
that's right. So yeah, so it will inhibit those guys. Now what do you think those guys are going to do to whatever else they're going to be connecting to?
Internally inhibit that.
Exactly. We'll see it again. We're just trying to make early connections before we actually get there. Okay, so pars reticulata, right? So is this the cell dense or cell sparse?
Sparse.
Sparse, right? So reticulum is like a net. So if it's a net, that means stuff is spread out. Okay, so pars reticulata is cytologically similar to GPI. All right, so globus pallidus interna. So globus pallidus interna and your pars reticulata are cytologically similar. And let's see if I can show you this. Should be here somewhere. Okay. So, I think the way Dr. Wilson explained this in class was that this guy here and this guy here were similar, but at the moment I'm not seeing why he said that. I think it might have been a different image he used. I'll probably check the lecture slide really fast. Yeah, okay, so yeah, so well you can see it here, right? GPI and SNR are identical. So it's not altogether obvious here as well, because this seems a little bit lighter than this, right? All right, but just remember that they're cytologically similar. All right, and so remember, we saw two things that were cytologically similar with the striatum, right? So we saw the caudate nucleus and the putamen, that they had the mosaic thingamajiggy, right? Remember? And now we're seeing the GPI, the globus pallidus interna, and the substantia nigra reticulata being cytologically identical. So that's going to be related to their function, right? So if we go down here, right? So we can see that these guys are grouped as the way that the basal ganglia is receiving input, and then these guys here are grouped as the way that the basal ganglia is outputting information. You see that?
Yeah.
So these guys are similar. The putamen and the caudate are similar, and the globus pallidus interna and the substantia nigra reticulata are similar. Cool. All right, so we already know the substantia nigra reticulata and globus pallidus interna are essentially the same structure, but just separated by an internal capsule, or by the internal capsule. So the internal capsule separated the what? The caudate and the putamen. And now the internal capsule is separating, what is it separating?
Substantia reticulata and the QTI.
Is it substantia reticulata?
Substantia pars reticularis.
Still not getting the whole thing.
Substantia nigra.
That's right. I'm just making sure you say the whole thing. I'm sorry. Okay, so cool. And then we said that the amygdala is not part of the basal ganglia, but it's normally included, right? Because it would be kind of weird to just snap that little part off, right? Just it would be kind of weird. It would just look so weird, right? Just won't be complete. Okay, so we talked about the anatomy, so the parts of your basal ganglia. So we just saw the parts. Now, what